Madam President, first I want to thank Senator Markey for his comments. I share his concerns. I agree with what he has said, the risk factors of the bill that was announced this morning by the Republican leader, what it could do to millions of people around this country, what it will do for coverage for hundreds of thousands of people in my state of Maryland who will lose coverage, and just about every Marylander whose health care will be impacted if this bill were to become law. But I want to start, Madam President, by saying I think this is a shameful moment for the United States Senate. The Senate, which traditions have made it be known as the most deliberative body in the world, the Senate, which has been known as a body that allows for robust debate and benefits from the views of all 100 members, that each of us have opportunities to get our voices heard, that tradition has been badly damaged by what the majority leader has done in bringing a bill that affects 1/6 of the economy of our country to the floor of the United States Senate without deliberation by our committees and without transparency to the American people. Madam President, when I got to the United States Senate, I worked hard to get on to the Senate Finance Committee. I did that because the jurisdiction of the Senate Finance Committee contains areas that I've devoted a good part of my public career to, including issues of taxation and issues concerning social programs in our state. But it also included health care, an area that I worked on when I was first in the Maryland State Legislature. I wanted to be on the committee that had a role in developing the health policy of this nation. I thought I could add to that debate with my experience, and I wanted to make sure the people of Maryland had a voice as we developed health policy in America. Madam President, that role is being denied by what the Republican leader is doing in bringing this bill to the floor without the benefit of hearings. Let me just repeat that. There has not been one hearing held on the legislation being brought forward by the majority leader. There hasn't been one committee markup of the bill. Now, let me explain to the general public what a markup is. It's when the bill, the committee that has expertise on it, in this case it would be the Health, Education, Labor, and Pensions Committee and the Senate Finance Committee, have had a chance to bring the public in to get their views on the legislation, to have the committee staff go through it and explain all of the aspects to the members of the committee, an opportunity for us to offer amendments to improve the bill, and then ultimately taking a vote on the recommendation to the full Senate. That is the regular order on legislation. But it's particularly the regular order on complex pieces of legislation. I don't think there's a member of this body who would say this is not a complex field when we're dealing with health care, 1/6 of our economy. But the process that was used denied the people of Maryland, the people of this nation, the opportunity to have their voices heard through their elected representatives. It's a shameful moment. Now, Madam President, I know this has been done before on the floor. I'm going to just repeat it one more time. Compare this to how the Affordable Care Act was passed by the United States Senate. We had transparency, opportunities for the public to have input. We had hearings, many hearings that took place. My staff tells me there were 50 hearings or roundtable discussions or walkthroughs. We had 26 consecutive days of Senate debate. There were hundreds of amendments offered by both Democrats and Republicans that were adopted on the bill before the bill reached the floor of the United States Senate. That all took place before we started the debate on the bill. You cannot justify this process. This is an abuse by the majority, and it will affect the functioning of the United States Senate. More of concern is what this bill will do. The process, terrible. The impact on the Senate, terrible. But the real tragedy here is the impact, if this bill were to become law, the impact it would have on health care in America. So let me talk a little bit about my state of Maryland. It has been projected under this bill that those who will not have insurance coverage will go back basically to what it was prior to the passage of the Affordable Care Act. That's a little over 400,000 Marylanders are in risk of losing basic health coverage. Now, Madam President, it's going to affect everyone with insurance in Maryland, and I'll get to that in a moment. But as many as 400,000 are in jeopardy of losing their insurance because of what is done in regards to the alliances and the Medicaid program itself. Many more will lose quality coverage. Senator Markey talked about pre-existing conditions. You claim that there is protection for pre-existing conditions, but it does not guarantee that the services will be provided, because the states are given tremendous discretion as to what would be a required benefit, essential benefits within the health care plans. So if someone has a mental illness or someone has a drug addiction, is there a guaranteed coverage that that person would be able to get services? And if that person has a pre-existing condition, it may very well not be covered because of the absence of essential health benefits. Let me just give you another example of what could happen under this bill, and this is a real example on gender discrimination. Obstetrics coverage is critical for a childbearing woman. Now, if that becomes an optional coverage because of the state plans and discretion that it's given, obviously only those women who are planning to have children will take that coverage. Why would someone who doesn't need that coverage take the coverage? What is the consequences of allowing that type of choice? It's very clear. Younger women are going to pay a lot more for their health insurance than they otherwise would. Is that fair? I think not. I think not. And that's the consequences of the type of changes that are being made in the Affordable Care Act. I was very instrumental in making sure that we had full coverage for pediatric dental. Why? Well, unfortunately, in my state in 2007, the year I first started in the United States Senate, we had a youngster, DeMonte Driver, lived not far from here, who died because of an untreated tooth decay. He became obsessed, went into his brain. He had to go through a couple surgeries, and he lost his life. What was needed was $80 of dental care. He couldn't get access to it because there was no coverage for it. He had no access to that care. He lost his life, and of course the healthcare system had to pay a lot of money when it only needed to spend $80 to keep him healthy. Well, we took care of that and fixed that with the essential health benefits now, including pediatric dental. Is that protected under the Republican bill? The answer is unclear. Probably not. Up to the states. Maybe different in one state versus another. We don't have the protection. And then we get to the affordability issue. For Marylanders to be able to afford to have health insurance. Under this bill, there will be discrimination on those that are older. They're going to have to pay more for their health insurance. Is that right? No, it's not right. I heard the majority leader this morning give examples of how the Affordable Care Act is in danger. And he cited high premium increases. And one of the states he quoted was the state of Maryland, which was very misleading the way he did that. He was talking about the individual marketplace, and he was talking about one segment of that. And what he didn't tell you is that Care First, the insurance company that is proposing that rate increase, indicated that at least half of that increase is a result of action taken by the Trump administration. Because the Trump administration has not made it clear whether they will fund the cost-sharing provisions, which keeps the costs down and affordable in the individual marketplace. That's a self-inflicted increase in premiums by the Trump administration. And there's a second issue that Care First mentioned, and that is the president's insistence on not enforcing the individual mandate, and by the way, that's in the Republican bill, means that younger, healthier people will choose not to have health insurance. Now, if they happen to ride a motorcycle and wrap themselves around a tree and get flown to shock trauma in Baltimore, we're going to treat them. Guess who's going to pay the bill? All of us are going to pay the bill through uncompensated care. It's going to raise my insurance policies and everybody's insurance policy. That person should have had insurance, but that person thought he or she didn't need that insurance, so they didn't take out the policy. And you find that those who will take out the insurance policies are the higher risks because they know they need the insurance. So those with high-risk issues will be in the pool raising the cost. And that's why Care First has a higher ask, because they know that there's less likely that healthier people will be in the pool than projected under the original Affordable Care Act. Why? Because of President Trump. So when the leader says that the Affordable Care Act is falling apart, the Affordable Care Act is strong, but it's been made vulnerable by actions of the Trump administration, and provisions in this bill will even make it weaker. 1.2 million Marylanders are in our state medical assistance, Medicaid program. Now, Madam President, many of these people are working families. Many of these people are seniors who need long-term care and are in the Medicaid program because it pays for their long-term care expenses. Many of these people are veterans, are returning warriors who are under the Medicaid program. Under the Republican-released bill, they may make it a gentler slope before we get to the full impact of the Medicaid reductions. But the Medicaid reductions, if I understand correctly, are even more severe than under the House-passed bill. Now, I can speak for Maryland. I know our legislature. Our legislature is going to try to do what's right. But they have limited resources in order to try to meet the needs that are out there. It's just not right to say that we're passing these problems on to the states when the states don't have the fiscal capacity to deal with it. Who gets hurt? The 1.2 million Marylanders who rely upon the Medicaid program, and all Marylanders who don't want to see what we call cost shifting, when someone who doesn't have health insurance ends up in our emergency room, doesn't pay the bill, and everyone else pays those bills. So why are we doing this? What is the reason why we've gone through this pain? And I've heard my colleagues talk about it, and it's absolutely true. The Republicans need to make room for the tax cut. They're pretty clear about it. Close to $1 trillion in tax cuts. That's what they need to do. Who benefits from the tax cuts? The wealthy. Those who have access to health care. And who pays for the tax cuts? Those who are the most vulnerable in our community. That is just wrong. My staff has put together a lot of individual letters that have been sent to us. I don't even need to go through them. I can tell you just experiences that I've had walking on the streets of Baltimore, or quite frankly, walking anywhere, including here in Washington. When people come up to me and say, Senator Cardin, keep up the fight. Do you know what was going to happen if that health care bill becomes law? We've done some tests, and we have certain genes. We're in a high-risk pool of cancer. We're not going to be able to get coverage if you let insurance companies go back to the practices they had before the passage of the Affordable Care Act. Or I talk to people who say if they didn't have the insurance that they think now they're going to lose, they would have to go through personal bankruptcy. That's not hypothetical. Bankruptcy, the leading cause before the passage of the Affordable Care Act was unpaid medical bills. We're going to go back to those days. Or I talk to a parent who has a child with a disability, and they go over the cost of that child's going to be in the healthcare system. And they don't possibly have the means to be able to afford that if they didn't have access to health coverage without discrimination. You leave these discretions to how the insurance companies respond, their businesses, they're going to figure out a way that that family that has that disabled child will not have adequate coverage. That's what's at risk. Senator Markey's right. Healthcare should be a right, not a privilege. And we're moving in the wrong direction. In Maryland, we have hospitals that are located throughout our state to meet the needs of the people of Maryland. So we have hospitals that are located in areas where they have a lot of elderly or a lot of poor people. But because of the way that we deal with our hospital reimbursements, we don't have cost shifting. We can have what's known as an all-payer rate, where whoever goes into that hospital pays the same rate. So a hospital can locate in the inner city or can locate in a poor neighborhood. If you increase the cost shifting, if people don't have insurance, healthcare facilities will not locate in those communities, adding to the cost of everyone's healthcare. One of the great benefits, one of the great achievements of the Affordable Care Act is that we now have facilities that are more conveniently located to the people of this country, whether they live in a rural area or an urban setting. Some are qualified health centers, some are just health clinics, but they're located because more people have third-party coverage, have insurance in order to pay those bills. So I read with interest that certain segments of the advocacy community are going to be given certain concessions in this bill, and they think they're going to be okay. One, as I understand, is I'm not sure what this term means, and so maybe someone can explain it to me, medically complex children. These are children, I assume, that have special needs. And if I understand the bill correctly, there's going to be a carve-out in the Medicaid system so that these complex cases will be, at least for a period of time, reimbursed. Where are they going to get care? Right now, they're getting care in many cases in a school-based health clinic that's going to be closed under the Republican bill that's out here because it's not qualified to receive reimbursement. Or the expansion of our qualified health centers under the Affordable Care Act is going to be in deep jeopardy. I've met with the CEOs of our qualified health centers where we've expanded to deal with pediatric care, dental care, mental health. That is in jeopardy of being contracted if you don't have the reimbursements from the people that live in that community that we have under the Medicaid expansion. That's in jeopardy. So don't believe that you're protecting any vulnerable populations when you don't provide the structure in which you can have reasonable reimbursements so that doctors and hospitals and clinics can locate in communities and be treated fairly under our reimbursement structure. So, Madam President, I am deeply disappointed. I am deeply disappointed of what we've done to this great institution on this such an important subject. I'm deeply concerned as the impact this is going to have on the people of Maryland and our nation. And I will join my colleagues in doing everything I possibly can during the limited opportunities we have only on the floor of the Senate, not in our committees, to do everything I can to protect the interests of the people of Maryland and our nation so that health care can be a right and not a privilege. With that,